Dear ladies and gentlemen, it's a great moment now to welcome you to this plenary session on the future of digital health in Europe and Central Asia, which so many of you have been mentioning. It is indeed a flagship of the WHO European Programme of Work. Actually, it was a flagship before the COVID-19, and since the COVID-19 has only increased in importance. The resolution in front of you is very crucial. If adopted, it will be the first digital health action plan our region has ever seen. It would be a momentous accomplishment. It includes clear guidelines and principles on how we can leverage digital tools with one goal in mind: to improve people's health, leaving no one behind. So not about championing or advertising the latest app or digital gadget. Digital health should instead be seen as a genuine enabler to achieve health goals and not as the solution itself to health problems. Governance, legislation and policies are even more important to implement than digital solutions themselves. When a digital solution connects a patient living in a rural and remote area with a pharmacist who can advise on the right medicines to take, or with their family doctor who can demonstrate on camera how they can care for an ill family member, this is digital health at its best. It is helping someone, somewhere, get the care they need when they need it, regardless of any other practical obstacles. We are now here to make sure that these tools can reach all those who need them. This first ever regional plan will give us common direction so that countries, according to each capacities and resources, can work together, leaving no one behind. And we will be here to support and work with you along the way. We will assist countries as they strengthen their health information systems to enhance their health system response. We plan to work with you to promote digital health literacy so that patients and health workers, including the elderly, have the knowledge and training to make the best of digital tools. We also plan to contribute to establishing telemedicine services in rural areas so that we can mitigate the disruption of services and deliver high-quality primary and community care. And finally, we will continue to provide you with the normative guidance and advice on how to ensure that the digital tools we adopt in the health sector continue to promote equity and protect people's privacy and human rights. Thank you so much for supporting the Digital Health Action Plan, whose impact, when adopted and implemented, will benefit millions of people. Thank you.
Merci beaucoup, Hans. Je passe maintenant volontiers la parole à Natacha, le docteur Natacha Azopardi-Muscat, qui va nous faire avancer encore plus en détail sur la thématique.
Merci. Can I have the slide, please? Behind me, it's just one slide to remind you of the framework and action plan. And basically, you will see that this action plan is all about putting people at the center. What do I mean? I mean that for digital tools to be successful, we need to focus on their health impact and not necessarily on the appeal of the technology itself. We need to be able to ensure that what we are introducing is effective. And for example, we've just published a comprehensive review on how artificial intelligence is being used in image analysis. And we found that whilst it can be extremely useful to clinicians and epidemiologists, we're still not having the benefit for patients. On a positive note, another review, we looked at the tools that we used during the pandemic, and we found that actually digital tools did help to combat the infodemic during COVID-19. So, Excellencies, it's clear that digital innovation is here to stay, and we are very heartened to see so many member states investing heavily in this area. I think the one question that we are all asking is how to ensure that this substantial investment reaps the benefits for patients and for our workforce. How do we embark on this transformative journey together? And today, by presenting this action plan and accompanying resolution for your consideration, we are committing to stand with you along the way by setting the much-needed norms and standards based on science, by working with you to build capacity to manage this transformation and to support the health workforce to adapt their skills to this new reality. By building networks across the region, working in partnership, because innovation for a greater good happens when we work together, and by ensuring that we focus on equity, leaving no one behind. I'd like to thank David Novillo and the team for their excellent work in putting the documents together, but also in engaging in a fruitful consultation. Thank you.
Merci Natacha. J'ai maintenant l'honneur de vous présenter Hal Wolf, le président et directeur général de la Société d'information sanitaire et système de gestion qui dispose d'une très longue expérience dans les questions de santé et d'informatique.
Healthcare and IT, so it's a real pleasure to give him the floor.
Il faut lever les micros.
Yes, there we go.
Yes.
Thank you so much. It is such an honor to be with you today. I am Hal Wolf, President and CEO of HIMSS, which is a global nonprofit. The vision of HIMSS is to realize the full health potential of every human everywhere. And with our 115,000 members, of over 40,000, which sit inside the borders of the countries represented here today, we focus on bringing digital health forward in order for the embetterment, as you can imagine, of health equity. Globally, health has similar challenges. There is a phrase that we use all the time in healthcare, that when you see one hospital, you have seen one hospital. And when you have seen one country, you have seen one country. But there are consistencies in the challenges that we all have. One is our aging populations, the silver tsunami. It is upon us, and people are living longer past retirement. But they carry with them chronic disease management that we have to manage. And we have still not fully defined the impact of long COVID and what it'll mean to our fundamental health systems. We are dealing with geographic displacement. And geographic displacement is not just rural or remote areas. In too many instances, individuals live in the shadows of some of the world's finest hospitals, but they cannot gain access at all or in a timely manner. So geographic displacement and its access remains huge challenges. On top of that, we are all faced with funding issues. There is simply not enough money. And even if you live in a zone that is currently being funded for extra distribution of digital health, it is still going to be a challenge in the next few years, as we know that the economic tide has been turning. And on top of those funding challenges is a staff shortage. We know from studies from the WHO that there are over 8 million gaps in clinicians necessary to meet the encounter-based paradigm we have today. And that number will go above 13 million in the short years in front of us. And finally, a lack of actionable information. So, we cannot build hospitals and clinics fast enough in order to meet the demands of population health and the growing needs of our constituents. And even if we could, we would not have the staffs in order to fill them. So what do we do? Well, first we have to break down healthcare. And I propose a single word that I use in thinking about what is health and healthcare, and that is anomaly. Health is about identifying the anomaly from the norm. We spend a tremendous amount of time in prevention to maintain normality. But then when someone has a problem or we do testing, we are looking for an anomaly. And when we identify it, we call it a diagnosis, and then we go to fix it. And that is care delivery. Digital health has the ability to impact all three phases of those basic elements of care, of a diagnosis, and the delivery of solutions. And digital health, as you go towards the investments that are absolutely necessary, I would encourage you to think of three critical strategies. One is to think of the home, the individual outside of the clinic and the hospital, as an extension of the medical and the care domain. And the second is to recognize that digital health can help and supplement from a workforce standpoint. And finally, it's also incredibly important to remember that this information that is generated is absolutely needed for population health so that we can maintain an anticipation of our challenges, not just in normalcy, but when we also have crises afoot. During the last pandemic, the one that we are still finishing, we had a massive gap coming out of the gate in information and data available to us. You remember the struggles in the first year. We were unprepared in our supply chain, and our staffs were unprepared to utilize the new tools brought forward to break out of the paradigm of the encounter base that we are now pushing through for the first time. As someone so eloquently put it just today, the great enabler actually happened in the acceleration because of the pandemic, a small silver lining. We know that basic cares and immunization were put on the back burner for almost 2 years, an impact of which we are going to have to catch up and understand the impact of it. But we eventually were able to turn the corner and get ahead of the pandemic. But it did not happen at any individual level. It happened because of a partnership that ultimately existed between the public and the private sector coming together, and all of the hard work of our front lines and our changes. And we did it because we were able to establish an expanded trust between nation and partners alike. And these are the practices and efforts that have been absolutely critical in this current success and will have to be in our future efforts, because as we've all noted, more crises will loom soon on our future. In short, no single country was able to fight the pandemic alone. It took a global village. Now, we all know the expression that we're only as strong as our weakest link. And the sharing of data and information was absolutely critical. If we reverse direction in any way, shape, or form, where we take data away collectively to look at population health in the state, we will be setting ourselves backwards. So this same village that we put together must be utilized to impact health equity, which is why the Regional Digital Health Plan for WHO Europe region for 23 and 30 is such a critical framework that we'll be talking about in more detail tomorrow. And I'm also very pleased to note that our organization, HIMSS, yesterday signed a memorandum of understanding in conjunction with WHO European region to encourage and promote digital health and health capacity by building across an entire region and strengthening the digital competencies of the health professionals, which will include also supply chain components and how to make sure that we are well balanced. So I call upon each and every one of you to help us to expand this village so that we can accomplish what we need to do in health equity. And together we can take steps in global health equity, and embrace the transformation of the global health ecosystem through the power of information and technology. Thank you for listening, and we look forward to tomorrow's discussions. Thank you.
Merci beaucoup, Hal.
Thank you
pour,
very much, Hal,
nous appeler à réfléchir et à nous engager.
calling
Je
upon
vous
us
propose
to
de
think
suspendre maintenant
and
ce
to
point sur
act.
la santé numérique.
So we're
Nous
going to
aurons l'occasion
suspend
d'en
this
débattre
item on
plus en
digital
détail,
health. We'll have the
demain.
chance to debate it in more detail
Avant
tomorrow.
de passer au droit de réponse,
Before moving on
je
to
vous
rights of
propose
reply,
également de
I
suspendre,
also
de maintenir
suggest
suspendu la question
maintaining
du rapport
suspended
du
the
CPCR,
question
puisque je
of the
comprends que des
SCRC
échanges informels
report
sont encore en
because
cours.
I have been told
Nous
that
entreprendrons
informal
donc sur ce
exchanges
sujet-là
are
à
still
nouveau demain.
ongoing, so we
Et
will
j'ouvre
come back to
maintenant
this
le droit
tomorrow.
de réponse
So I will now
et
open
passe en premier
rights
lieu
of
la parole
reply,
à la
and the
Fédération de
floor
Russie.
goes to the Russian Federation.
Vous avez la parole.
You have the floor. Thank you, Madam President. The Russian Federation, from the very start of the session, was against its politicization, and we spoke to this. Instead, we see that our calls have not led to a positive result. So we would like to say the following. Russia is organizing a special operation to end the aggression of the Kiev regime against the Donbass people. This has gone on for 8 years and has killed over 10,000 civilians. The aggression against Donbass began in 2014 when they did not recognize the coup in Kiev. Over the last 8 years, there has been shelling of civilian infrastructure, including healthcare infrastructure. The shelling by the Kiev regime continues today. Russia began its military operation based on Article 51 of the UN Charter, the right to self-defense. This was spoken about at the Security Council of the UN. Thank you.
Merci, la Fédération
Thank you,
de
the
Russie.
Russian
Je passe
Federation.
maintenant la parole
The floor now
à
goes to
la Tchéquie.
Czechia.
Madam Chair, distinguished Regional Director, Excellencies, colleagues, in reaction to the statement delivered by the representative of Russia and on top of the statement already delivered on behalf of the European Union and its member states, the EU resolutely supports Ukraine's inherent right of self-defense and the Ukrainian armed forces' efforts to defend Ukraine's territorial integrity and population in accordance with Article 51 of the UN Charter. Deliberate attacks by the Russian army on healthcare are well documented. WHO has reported more than 500 attacks resulting in at least 129 injuries and 100 deaths. The European Union condemns in the strongest possible terms the attacks by the Russian armed forces against health facilities in Ukraine. These serious violations of international humanitarian law must be stopped immediately. We call once again on Russia to stop attacks on healthcare and to allow the safe evacuation of civilians. Humanitarian corridors have to be created and respected with necessary ceasefire assurances. Free and safe access to those delivering medical and humanitarian assistance must be ensured in line with basic human rights principles and international humanitarian law. At all times, Russia must respect its responsibilities under international humanitarian law. The direct and indirect health impacts of the crisis on the health of the Ukrainian population is of the utmost concern to the member states of the Euro region. The regional director, Hans Kluge, and the director general themselves went to Ukraine to assess the situation on the ground and support the work of the medical and humanitarian teams deployed on the ground. WHO has updated its emergency appeal now designated for Ukraine and refugee receiving and hosting countries of $147.5 million in May, covering the first 6 months of the crisis. It is only natural that a health emergency of the scale of the one triggered by the unprovoked and unjustified military aggression be addressed by the Euro-Regional Committee. Russia's war of aggression against Ukraine continues to negatively impact the health situation all over the globe, including in the most vulnerable countries. Regarding the impact of the Russian aggression against Ukraine on the activities of the WHO European Office for the Prevention and Control of Non-Communicable Diseases, we look forward to the assessment that the Secretariat will conduct and to further discussing the opportunity and feasibility of a relocation. Our goal is to safeguard the technical cooperation and assistance provided by the aforementioned office. Russia's war of aggression against Ukraine continues to negatively impact the health situation all over the globe, including in the most vulnerable countries, as well as the work of WHO. Russia's blatant disregard for human life and well-being deems in an untrustworthy partner. EU and its member states therefore call for accelerated implementation of the resolution. Russia also needs to stop its disinformation campaign. That being said, we are expressing here and now our willingness to move forward with multilateral cooperation on humanitarian and health issues, which includes the work conducted within the Euro region with the Secretariat and its 53 member states. Thank you.
Merci.
Thank you.
Avant de conclure, j'aimerais encore vous
Before bringing
informer des
this session
derniers
to a
développements
close, I
sur
would like
les
to
discussions
tell you
qui sont
about
en
the
cours
latest
sur les
developments on
résolutions et
ongoing
les décisions qui sont encore
discussions
ouvertes.
on open decisions and resolutions.
Avant de le faire, je
Before
donne
doing so,
volontiers à nouveau
I will
la
give the
parole à la
floor
Fédération
once
de
again to
Russie.
the Russian Federation. You have the floor.
Спасибо, госпожа
Thank you,
председатель,
Madam
что
President,
я не остался незамеченным. Также спасибо в этом
for noting.
господину правовому советнику. Хотел бы ответить на заявление
We would like
представителя
to
Чехии от
answer
имени Евросоюза.
the
Мы видим,
speech of
какую
Czech on
помощь
behalf
оказывает
of the
страны
EU.
Европейского
We
Союза и
see
сам
the
Европейский
support
Союз
given
Украине.
by the EU
Поставки
to
тяжелого
Ukraine,
вооружения приводят к новым гибелям гражданского
delivering
населения на
heavy
Донбассе
armory
и
has
на юге
led to
Украины.
deaths of civilians in the Donbass and the south of Ukraine.
Мы также видим, как
We also see
подконтрольные европейским
how
странам средства массовой информации, которые имеют
countries under the
гораздо
control,
больший охват, чем
the
российские,
media under the
продолжают
control
свою
of the EU
дезинформацию,
continues its disinformation campaigns,
убеждая международное сообщество
convincing the
в
international
правоверных
community
действиях Украины, которые не являются таковыми и нарушают
that
международные гуманитарные
Ukraine's
правила и права. Спасибо.
actions are illegal under humanitarian law, international law. That's not the case.
Merci, la Fédération de Russie.
Thank you, the Russian Federation.
Je comprends que nous pouvons
I
conclure les
understand that we
débats
can now
de la
conclude the
journée.
debate
Nous
for
reviendrons
today.
vers
I
les
will
informations
come back with
sur
some
les discussions qui
information
sont en
on the
cours
discussions that
sur
are
les
underway
résolutions
on
et les
the
décisions.
decisions
Le
and
rapporteur,
resolutions.
Dr. Rui Portugal m'a informé
I have been told by
qu'un
Portugal
consensus,
that consensus
s'était trouvé
has been
sur,
achieved
la résolution relative à
on the resolution on the observation of cultural aspects for health.
Sur les autres textes se poursuivent encore. Nous allons donc conclure les débats de la journée. Nous reprendrons demain en premier lieu avec les remarques de notre directeur régional sur l'état de santé dans la région européenne de l'OMS. Et avant de nous diriger vers la réception que dont nous fait l'honneur Israël, j'aimerais passer...
I would like to give the floor to Natasha to provide some logistical information.